Good afternoon, everyone. My name is Ewan Armitage, and I'm an advanced clinical practitioner based in primary care. It's lovely to be able to talk to you all today. I have the pleasure of delivering a number of clinical education sessions in collaboration with Dovetail Healthcare events. And these include sessions on acute illness, sepsis, both clinical and for non-clinical grades. I do a session on chest pain, prioritizing clinical signs and symptoms. That's the red flag presentations. I do a session on remote triage, responding to clinical complaints in primary care, and of course, a session on minor illness. And it's this session that I'd like to share a little bit with you today. So let's have a little chat about this session on minor illness. So this is a very popular session which I deliver, and this is driven by the relevance in terms of what we see in primary care, but also your feedback which you've given to me after one of the sessions that we've run together, and requests that you've made to Dovetail. So in response to that, I've put together this training package for you on minor illness. Okay, now it is reflective of the percentage of the workload that we do see in primary care. We see an awful lot of minor illness, don't we? And the other benefit of this session is that it's not role specific, okay? You can be in a training role, you can be in a qualified role, you could be a nurse, physio, paramedic, pharmacist. It's not specific to your grade or your professional background. All are welcome, and this would be relevant to you. Or you can simply use this session as a refresher of your clinical knowledge and use it to help you develop your understanding of minor illness. Okay, but it's also an opportunity for you to consolidate what you have learned in practice, what you've seen, and what you already understand and are involved in supporting patients with minor illness presentations. Okay, so you'd be welcome. So please register your interest with Dovetail if this particular training package is of any interest for you. Okay, so in terms of the training outline, we look at three main things. So what is a minor illness? So we spend some time looking at the definition of that, and in particular, the level of acuity of these minor illness presentations. Okay, now one of the things that we do touch on is that acute does not necessarily mean minor. So it can be a little bit challenging trying to nail down a specific definition of what a minor illness is, but we do have good discussion on what you all see on primary care and what we could be reasonably expected to be seen and support patients with. We have a little chat about the timescales of minor injuries. When does a minor illness no longer become a minor illness? Very, very, very difficult to put an exact point on that, but we do spend a little bit of time looking at the timescales around that, and that's an important part of the discussion. And of course, that leads on to the scope of intervention that is required for a number of different clinical presentations, all of which are driven, of course, by each individual patient. So we do spend a little bit of time unpicking that, and in terms of your roles and responsibilities, in terms of what you should be able to do. Having done that, we then move on to talk a little bit about what is referred to as health literacy or self-care. Now, essentially, that is the patient's ability to manage their own condition, something that we use an awful lot in primary care, and people have very different ideas as what health literacy means. So we do go into that in a little bit of detail, and we look specifically at the interaction a patient has with the clinician and the relationship during a consultation and beyond. And we look at both chronic and acute presentations, because of course, minor illnesses can affect them both. It's not just acute, it can be acute on chronic, and it can be a little bit difficult for you if you do get more complicated patients coming through the door to see you. So don't worry, we spend a little bit of time going over that. And the other thing that we look at in the second half of the session is in relation to specific clinical presentations, and we have a number of case studies that we chat through on the day. Okay, so we look at what the most common presentations are in primary care. Now, it is only a 3-hour session, so we can't go through them all. So we do narrow them down a little bit into what I consider to be the most common ones. Now, the other thing to point out about this session, as well as it being from all professional backgrounds and any number of clinical grades, you would be more than welcome to join, is that this is very much a two-way session. It's very much interactive. So whether we deliver this face-to-face or whether we do this remotely via Teams, there is nothing worse, is there, than having death by PowerPoint. Okay, I've been on the receiving end of it myself, so don't worry. It's not just a case of following slide after slide after slide on PowerPoint. That's not what it is. This multi-professional discussion is absolutely encouraged, and it is expected of you on your course. Come and bring your questions, bring your experiences, share your learnings and any particular cases that you would like to discuss with the group. We'd love to have that on the day. So please do bear that in mind. Okay, because it does impact on your learning experience, and I don't think there's anything worse than sitting there for 3 hours while somebody rattles on going through PowerPoint. So don't worry, that is absolutely not what we are going to be about. Okay, so and let's have a look at a little bit more detail about exactly what minor illness section is all about. So we look at the historical position of primary care. Now that has changed markedly over the years, hasn't it? So I'm not specifically talking about the demand, but I'm talking about the evolution of the health service in particular and where primary care fits within that, and specifically where primary care fits in with that in terms of managing patients with minor illness presentations. We look at the evolution of things like minor injuries units and walk-in centres, because it's important to understand who is expected to see what and what your relationship is with them. When do we refer to them, and when would it be reasonably expected that clinicians in primary care take hold of the baton, so to speak, and support patients with these pathologies. Okay, we look at the management of undifferentiated care. Primarily, it's minor illness. We do look a little bit at minor injury, but the session is on minor illness, so that is our focus on the day. Okay, but we do look at the evolution not just of minor injuries units, but also things like acute medical units, same-day emergency care provision, surgical ambulatory care units, and the like. Okay, there are other points of access into the healthcare system, such as it is at the moment, and you'll have your own varieties, your own variations of this in your own particular area. But it is important to look at where primary care fits in with all of that and your role within that. Okay, so that's what I mean by the context. The mode of consultation is also something that we spend a bit of time on, particularly since COVID, where we did a lot, if not all of our consultations were done remotely, but that seems to have continued post-COVID in a number of areas. And I argue that's actually a good thing, offering different modes of consultation, because a lot of patients simply don't need to be seen face-to-face, but some do. So we do have a good chat about which patients fit into that bracket and which mode of consultation is the preferred and most appropriate. So we do have that discussion with you as well. Now, it would be remiss to talk about any minor illness without spending some time on clinical history taking. Now, the session isn't about clinical history taking. I am happy to do one if you want. So again, if there's something that would tickle your taste buds, please do let Dovetail know, and I'd be happy to pull something together for you. But in terms of the clinical history, we do need to spend a proportion of the session looking at what you should be asking, what you should be picking out, the key aspects of that, and of course, those all-important red flags. Now, I do a separate session on red flags, these clinical signs and symptoms of concern, but we do pick these out with regard to minor illnesses in the session today. Okay, so that's something that we do spend some time on and is relevant to all of us, whichever grade that we find ourselves in. And then, of course, we have that all-important debate, which I'm sure all of you have had at some point or other, is that difference between what is a virus and what is bacterial. I'm quite certain you have all, at various points along the way, have had these conversations with patients about antibiotic management. So we do have that discussion in terms of what a minor illness is and where it would be appropriate to consider antibiotics. But don't worry, we do go into that in some detail. So in terms of wrapping up, we look a little bit about the triaging of these patients, and that would include when you may well have initial telephone consultation, but actually you think, I may need to see this patient face to face. So what sort of circumstance would present itself that would merit you needing to bring them in? When would you need to do that? When is it clinically appropriate to do so? Okay, so we do spend a little bit of time of that. So even if triage isn't something which you are routinely involved in, okay, there are some salient points for all of us to bear in mind, and we do spend some time on that. How you should be approaching that consultation, that initial point of triage, various techniques that you can adopt, and we do spend some time discussing those with you, just to arm you with a few more clinical tools by the time you've finished the training with me on that particular point. Okay, and how you would arrive at a differential diagnosis, some of the strategies that we'd use for that. Okay, so in terms of medicines management, we take forward the discussion that we've had in the previous section in terms of what is virus, what is bacterial, because that is really very important in terms of minor illness. Not always very, very clear, and patient expectations is something that we talk about, and historically the position of antibiotic prescribing and some of the meds management issues around that. Don't worry, you do not need to be a non-medical prescriber to be on this course. It is not designed specifically for them. So please do come along, even if you aren't a prescriber, because this is something that you do need to be aware of and something that we can arm you with on the day. Okay, so I'm quite certain all of you at some point have had this discussion in there. Now, what I would say, we also have to spend a bit of time on the most common pathologies. Again, it's not a session that's devoted to underlying anatomy and physiology. We can do that if you want, but we just touch on some of the important bits, not just the underlying A&P, but how the disease progresses, and that's both viral and bacterial, and also when something is considered a minor illness and then perhaps becomes not quite so minor and becomes something that we're expected to do something about. So inevitably, we also talk about signposting, where we're referring patients to, or we're referring them to pharmacies, 111, out of hours. What is the appropriate point of access to the healthcare system? Worst case scenario, does somebody think this is a minor illness and actually they should be going to A&E? When does that circumstance arise, and what we should be doing in those circumstances? So we do have a good bit of discussion around that. We also have a look at the Pharmacy First scheme. It's been up and running now nationally, certainly for over a year now, but there's very much varied provision on this, depends on your particular area. So again, your reflections and your experience on the Pharmacy First scheme would be welcome, but it is a key point to consider when we are talking about minor illnesses. So pharmacists, if you're out there, you would be more than welcome to join in this session. It would be great to hear from you. Okay, so in terms of lesson 2, what are the objectives, particularly in relation to what we're talking about with health literacy and self-care? Now, it's a term that is very often used, isn't it? You hear it quite a lot, but what does health literacy actually mean? Okay, so we do need to explore this because a lot of patients don't know what it means. Clinicians have varying expectations of this, different perspectives. So we tease that out, and it would be great to hear from you in terms of what you think this is, and we explore that in some depth. Okay, so how does that translate into your clinical practice? Again, whatever role you perform, health literacy is something that we should be promoting. I find this one of the most challenging aspects of my role in primary care. It really can be quite difficult. Okay, so what are the implications for the patient, and what's the approach adopted by clinicians with regard to that? What have you done that has found has helped, and what do you find are the main frustrations in primary care when dealing with health literacy? Okay, Health outcomes, well, we all know what the appropriate health outcomes are for all the patients, which is resolution of their complaint. Okay, but there are other outcomes, including some adverse outcomes, and we do look at how to avoid those, how to spot them early, not just the red flags, but things like safety netting, review mechanisms, signposting. These are very important things for us to consider, particularly in relation to minor illnesses. So we do look at the health outcomes aspect of that, and what does it mean for the patient, and what does it mean for the health service as alone. Preferences of care. Again, I would suggest most patients are quite keen to avoid A&E, certainly keen to avoid hospital admission, as it should be for us. These are new priorities under the new government, under the Darcy report. So we do need to take that forward, all of us, irrespective of our roles. So how do we balance patient expectations with what clinically is appropriate? What are their preferences of care, particularly if something is relatively minor, but there are risk of developing more sinister pathology. So we do have a look about that. We do look about the importance of shared decision making. And again, this applies to all of us, regardless of our professional background. How do we reach that? And some of the strategies that will help us with that, but also some of the barriers. What are some of the things that get in the way of this shared decision making? What are some of the things that prevent good health literacy, which of course will help all of us? Okay, so these are some of the things that we do pick apart and spend some time on. So in terms of the additional considerations that we pick apart, we look at the clinical ones, obviously, but we look at social circumstances, the psychosocial part of it, the so-called yellow flags rather than the red flags, as it were. We look at how you might arrive at your decision making, not just shared decision making, particularly if you are at variance with the patient and a minor illness. How can we make sure our clinical decision making is robust? So we do look into that in a little bit of details. What should inform your risk stratification? With that, bearing in mind this is a session on minor illness, but we need to keep in mind that minor illnesses can evolve, they can change. In the vast majority of cases, I would suggest they self-resolve, but we need to make sure that your risk stratification, depending on the background of the patient, their underlying medical history, etc., there's things that you need to be aware of, and that's something that we do pick apart in the session. The clerking, what you document in your notes, whether you're in paper, I think most people are electronic or online record keeping now, and that's something that the session is aimed at. But we do look at what is expected of you in terms of your clerking, particularly in relation to minor illnesses. What are your legal and professional obligations in this regard? Even if you aren't professionally registered, and I would suggest that most of you are professionally registered, there will be a requirement of you, even at a local level from your employer, what you need to be documenting, what from a medical legal point of view will keep you and your employer safe. So we do have a look into that. So the communication aspect just picks up on that. That is both verbal and written. Okay, so we do look at some of the strategies that you find useful that you adopt and things that you should be looking to incorporate into your clinical practice. So it is very much a little bit broader than simply looking at the minor illnesses themselves, but it is something that we do need to get into. So don't worry, we do cover that. Then we have a little comfort break, and in the second half of the session, what we then get into are the specific clinical presentations. Okay, very, very important, this particular aspect of this. Now, as I say, it is a 3-hour session that we have, so we can't go into all of them. Okay, but again, it's based on your feedback and experience in terms of what we look at. Again, it's based on case studies, so I don't want you to come along thinking I'm going to be giving all this information dump to you. Okay, that is not the case. It is very much something that I'm expecting you guys to share with me as well. It is very much a two-way thing, and time is given within the program for you to share that. Okay, it's easier if it's face-to-face, I get that, but once we get the ball rolling, even via Teams, we usually get good discussion going on that aspect. Okay, so there will be a theoretical component to the course. There has to be, really, when we're talking about minor illnesses. We are also going to be looking at the clinical guidance which is out there for a number of the presentations. You will be given a copy of the slide deck on completion of the course. So there are a lot of references there for you. So you'll be signposted by me to a lot of the online clinical guidance which is available. It is publicly available, but you certainly need to be aware of it in your clinical roles. We look at the evidence base as well, what's out there. Now that's evolving all the time, but I do refresh the content every time I deliver this. So it is something that we will be picking up. With each new session, we will look at what best available evidence is and how you are expected to incorporate that into your practice, because there is a professional expectation that you do that. And we also look a little bit about case law and legal precedent around that. Don't worry, I keep it light. It's not too heavy and it's not the focal point for the session, but it just provides us with another perspective around management of these minor illnesses and some of the risks of that, of doing it. Now, remember what I said at the top, this is a multi-professional focus. Okay, so you don't need to be just a practice nurse or a paramedic in primary care. All of you are welcome. It is geared to those in a primary care background, okay, but an AHP discussion is welcomed and it is expected on the course, okay. So it is mainly within that primary care setting. Okay, so in terms of content, the way I've broken it down is we look at three main groups. We look at ENT, that's ear, nose and throat. We look at common issues around a cough, and then we look at what are suspected or confirmed urinary tract infections. Okay, so with regards to ear, nose and throat presentations, it's the bread and butter, isn't it, of what we deal with in primary care. I would argue this is the most common thing that all of us will see regardless of our roles. But there are some very sinister pathologies associated with that. So we do spend a little bit of time during the program having a look at what they are. Now, remember, I do a session on red flags. So if you want to look at this more specifically, please do let Dovetail know and we can get that session booked in. But we look specifically at the assessment of ear, nose and throat presentations, what the key points of your history taking, what your approach to history taking should be. And of course, as with all clinical presentation, what your management plan would likely look like at the end of it. We can't make it definitive because it involves patients and their individual circumstances and what they're telling you on presentation. But please do be in mind that this will teach you the basics of putting a management plan into place. Then we have a look at cough, and again we go back to what is a viral cough. I mean, how many viral coughs have we seen over these last few months, over winter and in spring? Loads of them. But how would that differ from a bacterial cough? What's the likelihood of a virus then developing into bacterial cough? What's the difference between the two? So, for example, between an upper respiratory tract infection and a lower respiratory tract infection, what are the key signs and symptoms of that? And what are the key points that you're looking to pick out in your history taking? Okay, loads of different causes around that. So don't worry, we do pick that apart a little bit. And there is an underlying discussion, as with ENT, regarding anatomy and physiology. Okay, we look at some of the first line interventions, typically self-care, but what would that look like? But when we need to escalate our care, and in particular when we need to be adopting second or third line interventions, and what are they, what would they look like, and when it would be appropriate for you to then escalate that care, involve more senior colleagues, or of course referral to secondary care. So that's something that we do spend a lot of time on, because cough is a very common presentation. And when we need to be stepping up that ladder, okay? And then we come on to UTIs. Now, I've said urinary tract infections. Actually, this could be urinary symptoms, full stop. So a lot of people immediately think it is a UTI. Well, in many, many cases, it's not. It's not just a UTI. There's lots of different things that this could be. And what we do during the session is, again, we pick that apart, we explore that apart. What could this be? It can be very tricky at times with urinary symptoms, particularly with older people, because there's a lot of overlap of symptoms. So we do spend a bit of time discussing that and talking a little bit about the physiology about that and how they may present in clinic and things that you need to be looking out for when you undertake your assessment. Again, we look at the current evidence base. We look at things like dip testing in primary care, massive issue again. When should we be dip testing? When we shouldn't be dip testing? What are you looking for when you undertake a dip test? Antibiotic management, massive issue in terms of urinary symptoms, certainly recurring urinary symptoms. So we do spend a little bit of time looking at that. And of course, wouldn't be complete without looking at the risk factors around that. So in terms of lesson 3, we do look at differential diagnosis for all of these clinical presentations. It isn't just urinary symptoms, okay? So we do look at lots of different things for both ENT and cough, okay? A little bit of pathology, but that's not what the session is about. It's about understanding how they present in clinic to you. Okay, as we've talked about, we're looking at both signs and symptoms, what that might look like for the patient, things that you should be looking out for. Now, I do take that forward in my red flag session, but I do cover this ground in the minor illness session as well. So if this is for you, please do let Dovetail know, because I do cover this in the session. We look at the position of comorbidities. That is to say, what else does the patient have as an underlying medical history? What are the things that we should be wary of? What should we be looking out for? So we do cover that. And again, it's just to add another tool to your toolbox. What else can you do? All right. So we do spend some time going over that. Some of the management approaches, not just in your consultation, but after they've left, be it telephone or face-to-face, things that you should be doing, how you should be framing that, and no more so than the review mechanisms and the safety netting around that. Often overlooked, I have to say. I've seen that quite a lot. So we do need to make sure that we are getting our reviews and safety netting correctly. It's a very important part of minor illnesses, or any clinical presentation really, but more so with regard to minor illnesses. So we do spend a bit of time on the day looking at that. Okay, so in summary, this is what we look at. As I say, it's a 3-hour session, but we do have a comfort break halfway through, and we're looking at some of the common minor illness presentations in primary care. We do look at both the diagnosis and the treatment of them. So there's a good interprofessional, multi-professional discussion around that. All of it is with the primary care perspective. It may touch a little bit on secondary care and some of the specialties involved in ongoing care with this patient group. But primarily, we are looking at GP. We are looking at primary care perspective. I do provide you with a list of further reading. The session is fully referenced, and that will be included in the slide deck for you. And as I've said previously, what I will also do is I will make sure that I will give you the clinical guidance that is relevant to you for that. Okay, so please do attend, and I will help you keep up to date with that. Now, in terms of assessment and evaluation, there is no formal summative assessment for this. It would be great to have your feedback on the day, and please do feedback to Dovetail on completion of the course. But really, it's all about you. Okay, it's not about sitting an exam or getting a certificate of competence. You will get a certificate to say you've attended, but there is no assessment on that. But your evaluation would be greatly appreciated. It's very much about me sharing my learning. I've worked across the healthcare sector. I'm a paramedic by background. I've worked in the ambulance service. I've worked in community. I've worked in A&E for a couple of years, and now in primary care. I've had a number of different roles in that time, and I'll share my learning and experiences with you, but please do share yours. As I say, it's a two-way session, and I'd love to hear those experiences from you. Okay, the case discussion will be all the better for that. It's not just about me putting up a slide and say, watch out for A, B, C, and X, Y, and Z. We need to pick it apart, and I need your help to do that. So please do come along, get ready to share your ideas and experiences. Happy to field questions on the day as well. I will also give you my work email address. So if there's anything that you want to follow up after the course, please do contact me. That would be very welcome. And I also identify other CPD opportunities for you, both in terms of course provision, which I have, and of course Dovetail, but provision that you can find online and further reading that you might find useful. Okay, so thank you very much for attending the webinar today. I hope you feel it was of benefit to your role, and I do look forward to seeing you on the day and taking part in future webinars with Dovetails. Many thanks.